Imagine if I told you that one of the most powerful medicines in the world does not come from a pharmacy. It has no side effects, costs absolutely nothing, and almost every person on Earth already knows how to do it. And yet, millions of people ignore it every single day. As a doctor who has spent decades treating heart disease, diabetes, obesity, depression, and chronic pain, I can tell you something surprising. Some of the healthiest patients I have ever seen were not necessarily those taking the most medications. They were the ones who simply moved their bodies consistently. And one of the most powerful forms of movement is something incredibly simple, walking. But what actually happens inside your body when you start walking every day? Not just once or twice a week, but every single day. Today, I want to explain what walking does to your heart, your brain, your metabolism, your joints, your hormones, and even your lifespan. Because once you understand what is happening inside your body, you may never skip a walk again. Let's begin with the most important organ in your body, your heart. Many people believe heart disease suddenly appears later in life, but the truth is, heart disease develops slowly over decades. Fatty deposits begin to build inside your arteries. Blood vessels lose flexibility. Blood pressure gradually rises. Now here is where daily walking becomes incredibly powerful. When you walk, your heart rate gently increases. Your blood vessels expand. Circulation improves. Oxygen reaches tissues more efficiently. Over time, this simple daily activity strengthens the heart muscle itself. Think of your heart like any other muscle in your body. If you never use it, it becomes weaker. But if you train it gently and consistently, it becomes stronger and more efficient. I have seen patients lower their blood pressure significantly just by walking 30 minutes a day. Some reduce their cholesterol, others improve circulation in their legs and prevent serious complications. But the benefits do not stop with the heart. Let's talk about your brain. Many people do not realize that walking has a powerful effect on mental health. In fact, some of the chemicals released during walking act almost like natural antidepressants. When you walk, your brain increases the release of endorphins and serotonin. These are the same feel-good chemicals that help regulate mood, reduce anxiety, and improve emotional stability. I have had patients struggling with stress, burnout, or mild depression who began walking daily. Within weeks, they noticed something remarkable. They slept better. Their minds felt clearer. Their mood improved. Walking also increases blood flow to the brain, delivering more oxygen and nutrients to the cells that control memory and thinking. Over time, this may even help protect against cognitive decline as we age. Now let's move to another critical system, your metabolism. Many people today struggle with weight gain and slow metabolism. They try extreme diets, complicated exercise routines, or expensive supplements, but often they overlook the simplest metabolic booster available, walking. When you walk regularly, your body becomes more sensitive to insulin. This means your cells can use sugar in the bloodstream more efficiently. As a result, blood sugar levels stabilize. For people at risk of type 2 diabetes, daily walking can be incredibly protective. I often tell my patients something important. You do not need to run marathons to improve your metabolism. Consistency is far more powerful than intensity. Even moderate daily walking can help burn calories, improve fat metabolism, and support healthy weight management. Now let's talk about something many people fear as they age: joint pain. A common misconception is that movement damages joints. Patients with knee pain or arthritis often tell me they avoid walking because they are afraid of making things worse. But in most cases, the opposite is true. Your joints are designed to move. Inside every joint is a fluid that lubricates the cartilage and keeps movement smooth. Walking helps circulate this fluid, delivering nutrients to the joint structures. Without movement, joints become stiff, weak, and more painful. Regular walking strengthens the muscles around your knees, hips, and ankles. Strong muscles reduce pressure on the joints and improve stability. This is why many orthopedic specialists actually recommend controlled walking for people with mild arthritis. Now, there is another fascinating benefit that many people overlook: your immune system. Your body is constantly fighting viruses, bacteria, and inflammation. When you walk regularly, immune cells circulate more efficiently through your bloodstream. This means your body becomes better at detecting and responding to threats. Studies have shown that people who walk consistently often experience fewer infections and recover faster when they do get sick. And then there is something even more profound: longevity. Research from around the world shows that regular walkers tend to live longer, not necessarily because they do extreme exercise, but because they maintain consistent daily movement. Walking supports the heart, the brain, the metabolism, the immune system, and the joints all at the same time. It is one of the rare activities that benefits nearly every organ in the human body. But here is something most people do not realize. Simply walking sometimes is not enough. There are common mistakes people make that prevent them from getting the full health benefits of walking. Some people walk too little. Others walk incorrectly. Some unknowingly cancel out the benefits with certain daily habits. And there are also a few simple techniques that can dramatically increase the health power of your daily walk. In the next part, I will explain the doctor-recommended walking habits that can transform your health, how long you should actually walk, the best time of day to do it, and a few small changes that can make your walks far more powerful for your heart, brain, and metabolism. Now that you understand what walking does inside your body, the next question is very important. Are you walking in a way that truly benefits your health? Because after many years of treating patients, I have noticed something interesting. Many people believe they are getting the full benefits of walking, but small mistakes quietly reduce its impact. Let me explain what I mean. One of the most common mistakes is inconsistency. Many people walk for an hour one day, then skip the next 3 days. From a medical perspective, your body benefits much more from moderate activity every day than from occasional intense effort. Your heart, your metabolism, your joints, and your hormones respond best to regular signals. When you walk daily, your body adapts, circulation improves, blood sugar stabilizes, muscles stay active, your brain begins to expect that movement. Consistency trains the body to become healthier. Another mistake is walking too slowly without raising the heart rate even slightly. Now, I am not saying you need to run or push yourself to exhaustion, but for walking to stimulate the cardiovascular system, your pace should be brisk enough that your breathing becomes slightly deeper. You should still be able to talk, but you should feel that your body is working. This gentle increase in heart rate is what strengthens the cardiovascular system and improves endurance over time. The third mistake many people make is sitting for long hours after their walk. This is something we see very often in modern life. A person may take a 30-minute walk in the morning and then sit for 8 or 10 hours during the rest of the day. Unfortunately, long periods of sitting slow down circulation and metabolism again. Our bodies were designed for frequent movement throughout the day. Even small actions like standing up, stretching, or walking for a few minutes every hour can keep your blood flowing and your muscles active. Now let me share some practical advice I often give my patients. First, aim for at least 20 to 30 minutes of walking most days of the week. For many people, this simple habit alone can dramatically improve cardiovascular health, blood sugar control, and mood. If you can walk longer, that is wonderful. But the key is sustainability. Choose a routine that fits naturally into your life. Second, consider walking after meals. This is one of my favorite recommendations, especially for patients concerned about blood sugar levels. A gentle walk after eating helps your muscles use glucose from the bloodstream more efficiently. Even a 10-minute walk after a meal can significantly reduce blood sugar spikes. Third, walk outdoors whenever possible. Sunlight helps regulate your circadian rhythm, which controls sleep quality, hormone balance, and energy levels. Natural environments also calm the nervous system and reduce stress hormones. Many patients tell me their minds feel clearer after walking in fresh air. Fourth, pay attention to posture. Keep your shoulders relaxed, your head upright, and your arms moving naturally. Good posture improves breathing efficiency and prevents unnecessary strain on the back and neck. Small adjustments like these can make walking more comfortable and more effective. But perhaps the most powerful benefit of walking is something that medicine is only beginning to fully appreciate. Walking reconnects you with your body. In a world filled with screens, stress, and constant mental noise, walking creates a moment of quiet movement. Your breathing slows, your thoughts settle, your nervous system shifts from a stress response into a state of balance. I have seen patients who began walking simply for physical health, but discovered emotional healing along the way. They felt calmer. They slept deeper. They began to think more clearly about their lives and their priorities, and this is something very important I want you to remember. Health is not built in a single dramatic moment. It is built through small daily choices, a short walk today, another walk tomorrow, and then another the day after that. Over months and years, these small actions reshape your heart, strengthen your muscles, stabilize your metabolism, and protect your brain. I have treated many patients who waited for the perfect time to start taking care of their health. Sadly, that perfect time often never came. But walking does not require a perfect plan. You do not need expensive equipment. You do not need a gym membership. All you need is a pair of comfortable shoes and the decision to begin. So if there is one message I hope you remember from today, it is this: never underestimate the healing power of simple daily movement. Your heart was designed to beat strongly. Your lungs were designed to breathe deeply. Your muscles and joints were designed to move. And every step you take is a small investment in a longer, healthier, more energetic life. Start with one walk, then another tomorrow. Your future body will thank you for it.